thanks for watching this video. So we're going to talk a little bit about your tooth or your teeth and some options you have for renewing them. Okay, so if you're getting ready to have a crown or a filling done, I'll kind of walk through why and what that is and what to expect before and after. So you may be asking, the difference between a crown versus an onlay versus a filling. Okay, so if less than half of your tooth is damaged, cracked, chipped, or has a cavity, usually a tooth colored filling, we bond those fillings in place. That's usually the best option. All right, if more than half of your tooth is cracked, chipped, worn, it's had several fillings over the years, things like that, then we'll likely do an onlay or a crown. Okay, now in the old days, crowns were really the only option, and you may have some crowns, or you may have seen crowns where they have metal underneath and you can kind of get a gray line around them. It's because there is porcelain on top of a metal piece inside to make them stronger. We don't do those kind of crowns anymore, all right? And the main reason we don't do it is we do an onlay type crown that saves more of your tooth. So with these old crowns, your tooth would be ground down to this little stump, and they were usually more sensitive, and more teeth required root canals, and you could get little gaps in there. We want to save as much of your tooth as we can. So these onlays are actually more technical from our standpoint. Okay, there's different angles and things we have to put on them. From your standpoint, they're easier to floss, they're easier to brush, they're easier to clean, and they feel more like your tooth because they're based on the natural shape of your tooth. The great thing too is they're all ceramic, which means they're white the whole way through. And so again, if more than half your tooth is broken or cracked, we'll do an onlay. Okay. So that's what you can know. So often, we'll see patients and we'll do several teeth with a bonded filling and then several teeth with onlays or crowns or veneers, depending on how damaged each individual tooth is. Now, if you're nervous about it, we do offer sedation or laughing gas to make it more comfortable. Okay, but 3 things that you should know about when you have an onlay type crown. Okay, our number 1 goal, when possible, is to avoid a root canal treatment. Okay, so if your tooth is so damaged that the cavity or the break's gone into the nerve, we will have to do a root canal as part of this treatment. But if it's not there yet, especially if it's a little sensitive or you're not feeling any pain yet, then our number 1 goal is avoid root canal. It's going to save you potentially thousands of dollars, pain, missed work, those kind of things. All right. The number 2 goal with this is that we want your tooth to be renewed to its natural shape, okay, and a nice natural white color. So we can make them really as white as you want. Most people like it to have a little bit whiter than what it was, but it'll match and blend in real nicely. And then the third thing is we want it to be smooth and long lasting. Okay, so we want your tooth to be functional, smooth. Nice thing with these newer onlay crowns is you can floss them easier. It also helps close food traps that you may have. It's very nice to your gums, and you can brush and clean these really well. You can floss them all you want. You can chew whatever you like within reason, right? A lot of people ask us, hey, what can I eat or not eat with this? You can eat pretty much anything you'd normally eat. I do recommend staying away from sticky candies, hard candies, gummy stuff, but I recommend that for your natural teeth or these onlays. There's really no difference. Those are just very hard on teeth. They tend to cause things to crack, chip, break. Okay, before and after expectations, okay, we have a couple different types of onlays. If you have our lifetime onlays, okay, lifetime crowns, okay, as long as you come into our office every 6 months or every 3 months or every 4 months, whatever kind of preventative schedule you're on, we will warranty these for life, okay? Your first visit with one of these, we will take the bad parts out of your tooth, rebuild the inside. We're going to get a putty impression, send it to our ceramist. It takes about 3 weeks to have your final one made, okay? So you should expect to be numb after, okay? You should expect to be able to chew after, okay? And do not floss, okay? Just that one tooth or the multiple teeth that have the temporary onlays on them. You do not want to floss those until the final one comes. All right. But you will be a little bit numb. You can chew and eat right away. We will put an acrylic temporary over it. And then in 2 or 3 weeks, we'll have your nice new tooth, and you can chew and eat right away. Okay, so after, yes, please do floss. Okay. Oh, by the way, before you can brush too. Okay, so please keep brushing. You want to keep plaque and things away. After you can floss, you can chew. Okay. If the temporary is kind of sensitive, or when you take the temporary off, it's sensitive, at your 3-week delivery visit, we may numb your mouth up. So we'll do a quick cold test on your tooth, and if you're feeling cold or discomfort, we'll numb it up. There's no extra cost to do that. We want you to be as comfortable as possible. All right. Now, we do offer some single visit onlays, single visit crowns. Okay. And if you're having one of those, there is no after visit. They're all done in one visit. Okay, and those can be a great option too. Okay, and we warranty those as well. But for our lifetime warranty and our longer warranty crowns, most of the ones our patients choose, those are 2-week. Those are 2 separate appointments, so you'll come twice. Okay, if you're doing more of the economy, basic type of crown or onlay, those are a single visit, and so you won't have the after. You'll still be numb. You'll be able to chew. You will be able to floss and brush with the single visit. All right, so keep these things in mind. Let us know what questions you have. We'll also give you some handouts that go through all these things, so you have a copy to take home. And we look forward to helping you keep your smile nice and bright. So thanks for taking some time to watch this, and we'll see you soon.